Good morning, good afternoon, good evening, everybody, depending on where you're joining us from. Thank you for joining our systematic review webinar. The facilitator is already here, but before I will give him the platform to share knowledge with us, I would like to tell us a little about the organization that is. Okay, I'm sorry, there's a comment in the chat box, which I have to address. I'm sorry, the time that we have been publicizing it has been 1 p.m. GMT and not 1 p.m. Watts. 1 p.m. GMT is 2 p.m. West African time, please. Thank you very much. I can understand the issue with the time conversion, but if you check the publicity flyer and perhaps the email we sent, it has always been 1 p.m. GMT. Thank you very much. I apologize if you have, if you misunderstood the time. All right, so this training is brought to us by the African Community for Systematic Reviews and Meta-Analysis. Our vision is to be a leading global community with an atmosphere that supports systematic review, research, and use in low and middle income countries. Our mission is to empower researchers from the academia and research institutions, especially early career researchers, with skills and resources needed to successfully conduct systematic reviews and meta-analysis. Our mission is also to cooperate and work with partners, stakeholders, research institutions, academic institutions to promote and improve the production and use of systematic reviews and meta-analysis, especially in low and middle income countries. So our main supporter are INAPS and AuthorAid. INAP stands for International Network for Advancing Science and Policy. AuthorAid is a flagship initiative of INAPS. So our programs are workshops, research activities in collaboration with the University of Rwanda, University of Lagos, Nigeria, and Nepal National Public Health Student Association, University of Calabar, Nigeria, Tropical Institute of Community Health and Development, Kenya, University of Port Harcourt, Nigeria, Federal University, Oye-Ekiti, Nigeria, and Obafemi Awolowo University, Nigeria. So like you saw in our mission statement, we will be organizing various webinars, but we will be accompanying these webinars with writing exercise to engage researchers, because we realize that organizing the webinars is one thing, but many of our participants, they are always calling for some kind of post-webinar engagement, post-webinar writing exercise. And that is why when we started last month, we created a WhatsApp communication group, and then we allowed some persons who had some systematic review topics in mind, or who were interested in conducting systematic reviews in a particular field or topic, to volunteer and lead a group. So from last month, we had up to 12 systematic review groups. So aside from attending the webinar on conducting and on developing topic and research questions, our participants were actually tasked with developing topics and research questions for systematic reviews. So our goal is to develop these writing exercises to systematic reviews. So for this month, at the end of the workshop anyway, you will get, or towards the end, you'll get a feedback form, the post-workshop feedback form. Then when you fill the feedback form, you will find a link to the workshop to the WhatsApp group at the end of the form. And if you join the WhatsApp group, you have a research topic in mind, you can volunteer to lead anything. But after this month, we will not be creating new groups again. Rather, we'll focus on developing the groups that have already been created. Thank you very much. So at this point, I want to introduce our facilitator for today. Is Dr. Thierry Ohawimana. He is a faculty member in the University of Rwanda, and is also affiliated with the Joan Briggs Institute. He is a systematic review expert, and he's going to take us through the difference between primary studies and systematic reviews, or why should you write a systematic reviews maybe instead of a primary study or any other type of review. Mr. Thierry, thank you very much for accepting our invitation. You can have the floor now and you can share your screen. Dr. Thierry, you can have the floor now, please. Thank you.
Okay, good afternoon, everyone.
Good afternoon.
Good afternoon, Dr. Thierry.
Okay, really hope that everyone is capable to hear me because actually it has been raining in Rwanda, and most of the time when there is some rain, it may affect the connectivity as well as the voice may not come out as some of the roofs of buildings are iron sheeted. Therefore, I was asking whether you can hear me. So, as the facilitator has said, my name is Dr. Thierry Uhawenimana, Thierry Claudien. I hold a PhD in nursing and midwifery research. I got it from the University of Dundee, Scotland. And like he has said, I am an associate editor of the Joanna Briggs Institute Journal of Evidence Synthesis, and I review for different journals. So far, I think there are three: the Journal of Open Nursing and the Rwanda Journal of Health and Medical Sciences. So when we opened this forum, I remember that I gave a talk. So for today, it's like the grassroots of what I have presented. So like you can see, the topic or the theme for today is, do I need a systematic review or a primary study? So the purpose for today, at the end of this webinar, participants will be able to get the necessary knowledge that will enable them to take a decision of whether they can proceed with a review, be it systematic or not, or scoping review, or meta-analysis, or even an umbrella review, or else if they can continue with a primary study. So the presentation will be for like 30 minutes. The whole webinar will be for like 40 minutes. Then the presentation itself will not go beyond the 20 minutes. At the end, we will have like 3 questions or 4 questions depending on the time that we will be having. So without taking much time, let me just proceed. So before we know whether we need to do a primary study or a systematic review, let's first understand what is a primary study or what is a systematic review. Normally, the primary study involves going to the field and collect the data that has not been collected before. Most of the time they call it primary study, others may call it primary research. It means you go to the field or you go to the library or you go to the community and then you collect the data, you analyze it and you present the report, and the data you collect, it has not been corrected before. So the goal of the primary study is to just contribute to the body of knowledge or to the existing literature. Then it requires rigorous methods of planning, implementation, as well as the presentation. If we talk a little bit about the rigorous methods of the planning, most of us who are here on this platform, we already know that before you go to the field to collect your data, or before you go to the laboratory to collect your samples and so on, you need to have a protocol, which is written in a rigorous and robust way, showing how, for instance, how many samples you will be collecting, how you will be sampling your population, how you will be collecting your data, how you will ensure quality, how you will analyze the data, and how you will disseminate the data, how you will write the report, and so on. So then, during the implementation, there are guidelines that you follow such that you collect the data of good quality. So then, the primary study, another characteristics of the primary study is that it takes time, or it requires time. It also requires the resources, and it also requires the skills in the research process as well as the methods, depending on the type of study you want to conduct. Here, a bit of clarification. If, for instance, you want to conduct an experimental study, you need to have the resources required to conduct an experiment, and you need to have those skills required to do an experiment, which might involve, for instance, the lab manipulation, all those needed skills. So as for the systematic review, so for the moment I use the term systematic review, given that the center that we have opened is all around the systematic review, but you already know that there is a generic term which is called literature review. So for the purposes of this webinar, I just use the term systematic review, which, as I said previously when we started this forum, a systematic review is a methodology on its own, which consists of reviewing the available literature on a certain topic, following a methodological process governing the review of literature. So for a systematic review, it consists of, you want to summarize the research literature about a certain research question you want to answer. Then you conduct a systematic review in a way that tries to identify, select, appraise, and synthesize all high quality research about the study question or the study question you want to answer. Then the goal of a systematic review is to summarize the research on a particular topic and represent the current status of knowledge about that topic. And some systematic reviews may be undertaken to confirm or refute whether or not the current practice is based on relevant evidence, or to establish the quality of that evidence, or even to address any uncertainty or variation in practice that may be occurring. This is actually typically for a systematic review. So meaning that, as I earlier said, for some topics, there's quite a lot of literature that have been published about that, but the fact is that there is a lot of literature published about a topic doesn't mean that all topics have been exhausted or any kind of knowledge needed on that topic has been addressed. Therefore, such a systematic reviews are always undertaken, whether there might be maybe the inconsistencies in terms of providing certain care. So then systematic reviews may be conducted about that topic to confirm or even refute what is being currently done. And also you have to conduct a systematic reviews to come up with the evidence that may improve the current practice. So then, whether it is primary research, whether it is a systematic review, what do you need to do before delving into them or before starting your journey of doing research? First of all, you have to decide you have to first of all get a topic, first of all. Then after getting a topic, you need to ask yourself a question. And after asking yourself a question, this will lead you to orienting your research question to a certain research design and the techniques that you would apply to answer the research questions you've asked yourself. So most of the time, all the common types of research questions may range between effectiveness questions. Here you can focus on evaluation methods of the treatment, for instance. It can be the designs may be causal. So when you want to know what causes a certain disease or a certain condition or a certain event, so then there might be designs that pertain to incidence or prevalence. This is in the case of epidemiology, where you look at the new cases or you look at the prevalence of those of certain disease within a certain community, for instance. The design might pertain to the screening, where the interest might be specifically for screening a program, for evaluating a screening program. The method may be diagnostic, especially for these studies that look at the accuracy of diagnostic test, for instance. And then the design might be pertain to prognosis, where you might be estimating the likelihood of the progress of a certain condition, or you want to look at the cost effectiveness of a certain intervention, and the design may pertain to psychosocial, where you want to know the people's knowledge, behavior, attitudes, and beliefs, as well as experiences. And this is where most of the time the qualitative methods of data collection will pertain to. So then these are typically the design for the primary studies, but actually if you look into the classification of the systematic reviews, you will find that there are systematic reviews of effectiveness, systematic reviews of cause and effect, systematic review which might be looking at the incidence and prevalence, and systematic reviews which might focus on the screening as well as the diagnostic test accuracy, and these systematic reviews which might concentrate on the psychosocial as well as the people's experiences, for instance, of illness or a certain treatment. So I will not go much into the details of the designs of systematic reviews and the primary studies, because I know as we progress, there will be other sessions or other webinars whereby we will go into the details of these designs. So for the moment, what I'm focusing on is the starting point. So then, once you've now asked a question, you've also decided on a certain question, on the questions you want to answer. Now you go to screen or to search for the relevant available literature about the topic or about the question you want to answer. So this is basically before you start. There is what we call scoping search. Normally, from the experience as a lecturer, I've seen that most of the time the student or any other person who wants to conduct research in our context, they come up with the topic and they start doing the proposal, but actually starting writing the proposal would be preceded by reviewing the relevant literature. So you just scope and find what has been done about the topic and find whether there might perhaps a similar study. And in doing so, you might even be minimizing any occurrence of duplication of the efforts. So when you do the scoping search, that's how we call it in the technical terms. When you do the scoping search or reviewing the relevant available literature, so you will know the scale of the problem you want to research about, first of all, and it gives you an idea of what is already known about the topic, and also you might get an idea of what questions you would focus on to inform practice. So you may start with a question to answer, then as you go through the literature which is available, you may change the direction of your study because you might come across other pertinent questions that might be answered so that there is an improvement in the practice or there is another way of doing things in providing care to the people. Then as you go along reviewing the relevant available literature, it presents an account of relevant research on the same or similar topics. So it means you are not the only person who is going to research about that topic. So in that case, when you are doing the review of the available literature or even reading the available studies on the topic you want to research about, it gives you an idea of how many topics you have tackled the topics or how many similar topics have been conducted about this topic and what has been the focus of these topics and what did they come across and what gaps have they left. So in so doing then, you may either decide to reframe your research topic, for instance, or reframe your study questions, or else you might continue with your topic, but maybe in another perspective. So, searching for the literature will help you to ensure that your research is addressing an appropriate gap in evidence. I said this because most of the time, you may be suggesting a research topic, and once you suggest a research topic, you end up duplicating what has been already done, which might be a waste in the time, a waste in the resources, except maybe if you feel that you want to do replication, some study maybe have been done, a similar topic have been done in a different setting from your own, where probably the culture, where the context are different. That's when you can do the replication. But if, for instance, the topic was done in Rwanda or in Nigeria, same area, and then you want to duplicate that, it's likely that you may not come up with something new other than maybe the waste of the resources. So then when you are doing literature or you review the literature before you start the data collection, it will help you to refine your research question and it gives you a direction as to what methods or what methodology you might apply to answering or to approaching your study question. Because you learn from what others have been done and how they have done that, then you look into their methods, and also you come up with the gaps in terms of the methodology. Then you can say, okay, I have this topic, but I see maybe these ones have mostly used quantitative methods of data collection. Now for me, I'm going to focus my study on, for instance, looking at the experiences of the people, or looking at the perspectives and the views on how they think about this type of treatment, for instance, or this type of this way of providing care, and so on and so forth. So then, before you really start the research journey, you should look at what has been done. For instance, you may look at different data repositories like Cochrane. You look at what reviews have been, what systematic reviews or reviews have been done about this topic, and what recommendations have they proposed that need further research. Then you can also look at the similar the similar studies, on the studies that are published on similar topic. Then you look at what have they done, what have they come across, and then what gaps have they found, have they recommended, and what are the limitations in those primary published studies, to give you an idea on where your research can concentrate. Then, if it is a trial, you may look at the trials that have been conducted about that topic to find whether there is no similar trial which has been proposed. Then, once you critique the methodology applied in the others' work, it gives you a better understanding and justification for your own research approach. So it isn't maybe waking up in the morning and you say, this time I'm going to do a longitudinal survey, so then I want to use this population. It has to come from the methodology, it has to come from the review of the literature, looking at what others have done, how they have done it, what aspect of the topic you are proposing which have not been tackled, and what are the common methodologies used in this literature that I have found about the topic I want to study about, and then how should I approach my topic? Because most of the time, as you know, on this forum, I think we are all healthcare professionals. And then, you know, the healthcare professionals may be seen in the clinical, social, financial, economic, culture, and even contextual perspectives. Most of the time, when you can be reading, then you find the topic you want to study has been tackled from the clinical perspective, but you find there are gaps, for instance, on the cultural, the social cultural aspect of that topic. Then you say, okay, I'm now going to orient my study, for instance, by looking at the social, cultural, or contextual perspective of this topic, because maybe much is published about the clinical aspect of the topic I want to study about. So, what should be next after identifying the nature of the available evidence and having determined the gaps? So you select the study design and the methods, be it a systematic or be it a primary study. So you have to make sure that the type of the research question you are asking should be consistent with the choice of the methodology you want to apply to it. For instance, if you say, how do people perceive the COVID vaccination, you might not apply, for instance, an experiment. In that case, you might apply, for instance, the qualitative methods of data collection to get different perspectives on how they think the COVID vaccine is and what they think are the effects or are the benefits and so on. So then you have to, after having chosen the method, you also to think about the resources you have and the time you have, because all of this will determine either the sample you will have for your study and even how much data you will be collecting. Then you also conduct your study based on a certain purpose, isn't it? So it means if you intend to generate knowledge, this will determine the type of study you conduct, whether it will be primary study or whether it will be systematic. So if you want to improve practice, so then it will determine what type of study you will correct, or if you want to inform practice, or if you want to develop the protocol tools and so on. So the purpose, the end result of the study, or the end result of the nature of the study you want to conduct will determine whether you will conduct either the primary or the systematic review. So then the skills you have. You may be having skills, for instance, in doing surveys. You may be having skills in doing qualitative study. You may be having skills maybe in doing experiments. You may be having skills in doing reviews and so on. These will determine whether you need a primary study or whether you will conduct a systematic review. Because you might not venture into doing a systematic review if you don't have sufficient skills in conducting reviews, for instance. So then, the purpose of research. When I talk of the purpose of the research you want to conduct, some of the people might conduct research because they want a degree, for instance. You might be conducting a research because there is a project, maybe you are paid for that, consultation, and so on. So all these will determine the nature or the type of the research you can conduct. For instance, if it is a consultation, part of the reference, part of the terms of references might be okay in this consultation, maybe project or contract, you are required, for instance, to do a systematic review. So if a review is a part of what you have to conduct or a primary study, so then this will determine what study you conduct, so given the context. Then, having gone throughout all of this, now we can ask ourselves, when should a systematic review be conducted? So a systematic review will be conducted if you are sure that there is sufficient information or sufficient published and unpublished studies about a certain topic. So then, in that case, if you've gone through, you've done a scoping search and you find that there is much published about that topic, then in that case you may be thinking about doing a systematic review before you do any primary study, because you need to find out what is available or what is the nature of the available evidence and what are the gaps and what should be the way forward. That is when there is sufficient information about a certain topic. Normally, that would be the norm. But most of the time, given our context and our educational systems, it is not what is done. Then, you want to find out if there are variations in the practice that might be leading to conflicting evidence. In that case, you need to look at the available evidence and then you analyze it to find whether what is available might solve those conflicting evidence in the practice. So then you might be interested to identify the deficiencies and the trends in the current evidence, and then you develop ideas that can inform the future research in the area. In that case, you may need to conduct a systematic review. So then, if you want to develop clinical decision-making guidelines, or you want to develop the protocols that might guide the delivery of care, or you want to develop a policy, in that case, you can conduct a systematic review before developing the policy statement, for instance, or before you develop the clinical decision-making guidelines. Then, you can conduct a systematic review if your research question has to be only answered by a systematic review. So in that case, for this one, I'm not going into the details of it, but there is a way of formulating a research question, and I think there will be maybe a webinar on how to formulate a research question in a way that it is answerable by a systematic review or by a certain kind of review based on the design of that review. So then, before you think of conducting a systematic review, you need to have a team of experts. So a systematic review, it's not a task, or it's not a research type that is done by only one person. So it requires a team of people. A team of people because, as you know, in the systematic reviews, depending on the nature of the review, there might be some reviews which might involve researchers of different study design, and then you need that expertise of the people who know how to search for the studies, because even formulating a search term requires a certain level of skills. And then you might need a team of the people who are capable to do the screening and also to do the appraisal of the studies you've conducted. And you also need a librarian who might identify the different databases where you can search for studies. So that's why in a systematic review, if you think of doing a systematic review, think on whether you have that team of experts. So then if you are doing it on your own, so it's likely that the product you will end up getting will have biases no matter what. So then, if you think of doing a systematic review, you should think whether you have sufficient time or whether you have the time it takes to conduct a review. Normally, a systematic review is called a systematic review if it is conducted between at least from 6 to 18 months. That's actually the time, the minimum 6 months, then the maximum time 18 months, and maybe it might be beyond, depending on the volume of the studies you may get. Because if you get a high volume of the papers, so it may take you time to do their screening, it may take you time to do the selection of the eligible studies, it may take time to also synthesize them and so on. So then, if you want to conduct a systematic review, you have to think of whether you have the methods of minimizing or detecting the biases, mostly in the individual included studies. So then, when thinking about doing a systematic reviews, you need to also consider whether you will have the means or the team who might help in doing the translation. For instance, translating articles that are in English, for instance, translating articles that are in Arabic, translating articles that might be in Portuguese or Spanish or even Chinese or Swahili, you know, because we know that there are different journals that are publishing data in different languages. So if you take, for instance, and if you say, for instance, that you will include in your systematic review English language only studies, so there is this likelihood of selection bias. So basically, the message of the day: do I need a system? Do I need a primary study, or do I need a systematic review? There are 2 or 3 key messages. It depends on the volume of the work published about the topic. Some of the topics might be under researched. So if it is a topic that is under researched, that time it's a primary study. So, but if a topic has been researched about and there are many studies about that topic, so before you do any other thing or any other primary study, you should consider reviewing the available work about that topic to give you a direction on whether you continue with a primary study, and if you have to continue with the primary study, what should be the orientation of your primary study based on the current status of knowledge and based on the gaps that are in place. So then that stage is what we called scoping search. You've done a scoping search, you've identified the number of the evidence about the topic, but still given the time, given the resources you have, given the skills you have, you might say, okay, I don't have maybe sufficient skills to do a systematic reviews, but I may approach this topic from a different angle, given the gaps I saw when I was doing the scoping search. Or else, you may also consider to see if you have sufficient skills and sufficient number of the people, I mean the team, and also if you have those resources, both financial, both time, and both human, to really enable you to conduct a systematic review or a review. So then, by doing that, this will give you an idea of whether you conduct a primary or you conduct a review. Then if you decided to do a systematic review, then make sure that you have all the requirements of doing a systematic review: time, team of experts, then expertise in the methods of the review that you will be undertaking. So thank you very much for being kind and attentive to this presentation. Like I said in the beginning, we may receive like 2 or 3 questions before we call it a day.
All right, thank you very much. Thank you very much, Dr. Thierry. I don't know if anybody has any question. You can either drop it in the chat box or you raise your hand. Dr. Thierry, you said we should take how many questions? 3.
Yes, 3.
Okay, okay. You can drop the question in the chat box or you raise your hand, please. Meanwhile, while we're waiting for the questions to come, I have shared with us okay, we have a hand that is raised. I have shared with us the post-workshop survey. I've also shared the link to our website and all our social media handles.
So let's hear from Khalid.
Khalid.
Yep.
Okay. Khalid, you can go ahead, please. Khalid, can you hear me?
He's muted.
Can you hear me, please?
Yes, yes, please. Thank you.
Yes, thank you, Doctor. I want to know only one question. It's, when I'm doing my research, is there any topic have you before did? Is there any question have you did before for about how to select the topic before I'm doing my review questions? Number one, if there is any topic, you can give us the link of how to select the topic. I would appreciate. Thank you very much.
Okay, thank you very much. Normally, when I prepared in my presentation, there was a slide about what should direct you in choosing the research topic, but unfortunately I removed it. But I think for the purposes of this question, I will add it. But normally, when you are before you start your research journey, topics may come from different places. So topics might be different from your surrounding. For instance, if you are a clinician or if you are a student, you do the clinical practices, you go in the bedside and you look at the practices of the people who are providing the care. So you hear what the colleagues may be saying, you even observe what is in your environment. There you can get the topics for either primary studies or even systematic reviews. So then topics might also come from reading the literature. So if you are interested in reading, because I know when I talk of reading, from what I have remarked, what I have observed is that most of the time we fear reading. So, but when you read, you realize the gaps. You even see the limitations in individual papers that you read, and those can give you direction as to how you can formulate your research topic. So I know that there will be, maybe the colleagues may prepare a short session on how to develop a research question. Because I remember in the topic that I teach at the master's level here at the University of Rwanda, we have a topic which is called researchable question. So for a question to be researchable, it has to really be relevant to the issues currently affecting the practice or to the issues that are affecting the general population, such that once you do your research and you get to the results, then they can make an impact. So it means it's not just a matter of saying, okay, this research topic I'm formulating this way. So you have to think on the impact that research topic might be having, such that if the issue is not resolved, might affect the lives of the people or might maybe cause harm to the people. So maybe we shall have a session dedicated as to how you formulate your research question, be it primary or be it systematic review question.
All right, thank you, Dr. Okay. Thank you, Dr. Jerry. I will just take this one. This one is in the chat box. This is from Pionil Mukabogora. Sorry. What are the different methods of conducting a review? Mr. Thierry, can you take that, please? Different methods of
conducting
different methods of conducting a review.
Okay, so different methods of conducting a systematic review. I will briefly talk about that because I don't know if the person who asked about that wanted to know about the process of conducting a systematic review, or whether he or she knows, she wants to know different designs of systematic review. But I will answer based on both because there are different designs of systematic review, which will dictate how you will conduct them. For instance, if I start on a scoping review, given the purpose of a scoping review is to explore the current status of evidence and identifying the gaps and determine the way forward, that type of systematic review, which we call a scoping review, will not have the appraisal for studies, because actually we are not daring to get the best evidence available on answering, for instance, on formulating a policy or decision-making guideline or any other type of intervention. That's why we don't do the appraisal, or we don't assess the methodological steps in individual studies involved in scoping reviews. But if the review is about you want to come up with a decision-making tool, or you want to come up with the evidence that may inform practice, for instance, this one has to rely on the best available evidence. So the way you achieve on the best available evidence is that in addition to doing the search, in addition to screening the studies to obtain which ones are relevant to the study question, and even retrieving the data from those individual studies, you will have a stage where you conduct what we call quality assessment. So by the quality assessment, you need to check the reporting of the methods chapter to find out whether the results obtained match what is described in the methods. So in that case, you might find that there are some areas of the methodology that, for instance, have been misreported, or which might not match the results that have been reported. And you might also find some irregularities and some cases of misconduct in terms of the way the research has been conducted. You might even detect the biases. So once you detect all of those through that process of doing the quality assessment, in that case, the study might not be eligible for being included in the final synthesis. So that one is for systematic review. So really, I might not go much into that because I'm very sure that we will have some other sessions that will be focusing on the different analytical approach for different systematic reviews. Like the question asked by our colleague Adedamora, asking the difference between systematic review and meta-analysis. So meta-analysis is a type of a systematic review which actually focuses on aggregating on having an aggregated statistics from individual studies, from homogeneous studies. When we talk of homogeneous studies, these are the studies which have similar designs, which have applied similar analytical approaches, such that the results from them, when pulled together, they can come up with, for instance, a new finding that may inform the practice. That's why they call them meta-analysis. So this is actually applying to quantitative studies, especially those quantitative studies which, for instance, have similar study design, let's say randomized controlled trials pulled together, and they have the same analytical approach, such that once you take the statistics from one study and another study and another study, You bring them together so that you get a new finding. That's why they call them meta-analysis. So a systematic review, even though meta-analysis is a type of a systematic review, which is quantitative, there are other systematic reviews that might be quantitative, but bringing together, for instance, quantitative studies of different designs. So it all depends on the type of the question you are asking and what you want to achieve. The same as there are systematic reviews covering qualitative studies. So let's perhaps maybe organize another webinar by some of my colleagues who will give further or extensive explanation on these systematic reviews, meta-analysis, meta-synthesis, systematic review of effectiveness, systematic review of prognosis, systematic review, realistic systematic reviews, mixed method systematic reviews. So I think there will be a sessions that might focus on each of these different designs of systematic reviews, such that participants might understand different designs of systematic reviews and how they correspond to different designs of primary studies. So the other colleague called Osadoro, not sure if I'm pronouncing it well, he has asked, what are the guiding rules when writing a systematic review? For this one, we will also have a session on developing a protocol for systematic review and how to write a systematic review report. I think for the write-up of the systematic review report, there's this guideline which we call PRISMA, which gives you an account on how each step involved in a systematic review, how it should be reported when, for instance, writing the dissertation or even writing a paper for publication, for instance. So I think this can also constitute another session.
All right, thank you very much, Dr. Theory, and thank you, everybody. I think we have to stop there for the questions because it's already 2 minutes. We have just 2 minutes left for this session. Please, we want to explain again or emphasize again that the WhatsApp group is for participants who are ready, and of course, they are available to conduct a systematic review. So this is how we will do it. When you join the group, anybody that has a systematic review topic in mind or a systematic review project is currently working on and wants a team for it, will make the call in the group. And if you are interested, you can message the person and the person will add you to the group. And then we start the project. We started it last month and we've had about 11 submissions. We have submissions from 11 groups. They have submitted topic and research questions. So what we want to do now is to create new groups. That's for those that, they do not belong to any group, any of these 11 groups. So if you want to join a new group, that is why you have to join the WhatsApp group. So I'm going to send the link very soon. Okay. All right, I have dropped the link in the WhatsApp group now. So once you join and you see any call in the area that you're interested, you can message the person or maybe the topic lead or the systematic lead, and then you start working from there. Our job is to see how we can be reviewing each section or each of your submissions. I mean, all the submissions, for example, the topic, the inclusion and exclusion criteria and research strategies, and to also provide some form of training, whether it's in-house or it's an open webinar, throughout all the steps in the systematic review process. So if there is any question, I'll just give room for one question before we can round up, please. Dr. Thierry, I'm sorry. Do you have any other thing to say to us, please?
So the only thing I have to say is to thank you for having organized this webinar and also thank the participants. I'm really happy that people have joined, and I hope that as we progress, we will be trying to clarify some of the things that might have been left unclarified. And also as we progress, people doing the practice, I'm very sure that, because actually the theory might be better if it is backed by practice. So it is in that case, if we might get perhaps a way of providing theory and also combining it with practice, it will enable the participant to really get two grips on how to do a systematic review and how they can make that decision of doing a systematic review. So otherwise, I say thank you very much to everyone here, not 14.
All right, thank you very much, Dr. Thierry. It's been a very insightful session. I'm sure that we have learned a lot. Thank you very much for honoring our invitation. I've shared the WhatsApp link again. Please let me know if you're having any challenge joining. If you have any challenge, you can always email us or reach out to us through our social media. And also, I think we have other ACSIM co-founders here. We have, just a second. Okay, they are not on call right now, but this is our email. If you are unable to join the WhatsApp group, just message us on email and we'll respond. Thank you very much. The link to the recording and the slide will be shared to our emails. Thank you very much for joining, and see you next month.
All right, thank you very much, and see you again.
Thank you.
We'll see you. Thanks, everyone.
Thanks.